Recording in progress.
The data we had was not good enough for me to be able to show in 2 years that we'd actually improved health status. We thought we did because we had more services, we had more people involved. That is, we were providing more services to more people. And our assumption was that folks were better off for that, but I wasn't at a point where I could prove it. Of course, the other thing we were doing was bringing medical students into this area. Most of the staff, most of the board members thought that was positive.
Was there baseline statistics on diseases?
I'm sorry?
Were there baseline statistics on all kinds of health parameters that would have given you a baseline?
Yeah, not very good. Not very good. And we didn't get to the point in the time I was there to really have solid health data. We were working towards that, but we didn't really have it. So I couldn't say, your infant mortality has gone down or your maternal mortality has gone down and all of that. There just weren't enough numbers and enough previous numbers, that is data from previous years, to be able to securely demonstrate that. We were able to show that more people were getting services and that salaries were higher and more people were working. We could certainly do that. And it seemed to work. I know that after we left, we were in these very temporary headquarters downtown, but let's see, when were we back in Hazard? 1984, maybe? 7-8 years later, I was asked to come back to speak at the dedication of the new Kentucky River District Central Office. That's where I became a Duke of Hazard and got my key to the city of Hazard, which is a very beautiful brass bottle opener key. So for the most part, it seemed to have worked administratively and politically. We did say that politics were tough politics in rural Kentucky. And each county, I think, was run by a county judge, so-called elected county judge, or a small group of county judges. Each county was kind of a fiefdom for these folks. And while we acquainted them with what we were doing, and I was concerned that we might get some pushback because these folks are used to running everything and running it to their benefit sometimes. And that concerned me, but we got no interference from them at all. And I kept asking the Kentuckians I was working with, how did we get away with that? And they said, probably because public health was such small potatoes, they thought that there really wasn't much there for them to control, not much that they could gain out of controlling this whole business. And they let it go, whatever it was. I didn't ask the judges why they didn't get more involved with us, but that was the sense of some of the folks I was working with. Who knows? In any case, it worked out pretty well.
My guess is they would say, well, that ain't really our bailiwick.
Mm-hmm. Yeah, maybe so.
Not their area.
Right.
Not something they knew much about, not something they wanted to spend a lot of time on.
I suspect.
And they certainly weren't in a position to provide the expansion of services by category that you did. You don't have to have baseline data to show benefit if you can say, we're now doing this number of breast screenings and this number of tests for this and this amount of education on birth control. The very existence of the programs, I think, is enough early on for people to say, this makes sense. And of course, the federal funding, you can't argue with money.
That's right. Yes, right. So the benefits were implied. That is, the health benefits were implied. The political and social and financial benefits were real.
Right.
Yeah.
Okay, I'm going to put us on hold here.
Mhm.
Recording stopped.